The ideal baby skincare routine focuses on building the skin barrier from birth. The key principle to understand is that newborn skin is still developing and, in fact, is trying to adjust to its new environment. From being bathed by amniotic fluids within the womb, baby skin is now exposed to airborne pollutants, volatile organic compounds, allergens, as well as a whole host of potential triggers in the environment such as dust mites. Baby Beauty is the new baby skincare kit created for new moms, a complete all-in-one baby skincare set for your newborn's needs. Welcome to Dr. TWL Pharmacy, your one-stop pharmacy for the whole family. Our in-house baby skincare brand, Baby Beauty by Dr. TWL, has just launched a newsletter. For a limited time, all Baby Beauty skincare set purchases come with a complimentary copy of Baby Skincare Bible, the only handbook you need for your child's skin health. We're first going to go through the differences between baby skin and that of an older child's. There are fundamental differences between newborn and adult skin. Specifically, newborn skin is much thinner and hence more fragile. Newborn skin is not considered fully developed yet and is in fact in an adjustment phase. Newborn skin is also considered as more permeable in the sense that it absorbs toxins more readily via the epidermis. And there is also increased water loss to the environment, a phenomenon known as transepidermal water loss. Baby skin is also easily irritated by friction. This fragility is in part due to the fact that baby skin is not fully developed and also the fact that there are clear structural differences between baby skin and adult skin. For instance, when examined under the microscope, the topmost layer of skin cells, known as the corneocytes, are actually much smaller. You may also have heard that skin cells undergo a cycling process, which in adults takes an average of about 27 days. In babies, the skin cycle is shortened to about 14 days. As we mature, our skin cycle also lengthens, and this is why aging skin also appears dull. The dead skin cells accumulate for longer periods of time. And once one enters into their 30s, the skin cycle increases in length to about 30 days. Baby skin renews much quicker than adult skin, which explains why scars heal well in babies and young children. The movement of cells from the bottom to the topmost layer is completed in about 14 days. Another characteristic of baby skin is that the dermis, which is the second layer of skin, is much thinner than adult skin. The reason lies in the structure of the collagen fibers, which are much shorter in newborn skin. In addition, the reticular layer is absent, which is also why baby skin feels softer. Another important point to note is that skin is an organ that absorbs through its surface. The structural differences of baby skin is such that it allows transdermal absorption much more readily. We are, of course, most concerned about potentially toxic ingredients, which would otherwise be well tolerated in adult skin and not pose health risks. A case in point is chemical sunscreen, which is currently not recommended for use in those under 6 months of age. Another factor to consider is that newborn skin actually exhibits increased moisture loss by evaporation. Transepidermal water loss is the process by which moisture is lost to the environment via evaporation. This is a problem in those with a damaged skin barrier, for instance, those with eczema. However, as newborn skin is not fully developed, it lacks the intact skin barrier of older children and hence is much more susceptible to transepidermal water loss. To combat that, here are some tips. Avoid air conditioning, keep baby well hydrated with fluids, and also remember to choose a well-formulated moisturizer with the ideal composition of lipids, antioxidants, and anti-inflammatory agents. Moisturizers should also contain a mixture of emollients and actives. For example, ceramides, humectants such as glycerin and hyaluronic acid, all these methods can effectively reduce transepidermal water loss in newborn skin. Now, we've touched on skin fragility, but I would especially highlight the risk of frictional damage. We take for granted things like the material of the clothing we wear, even wiping our skin with towels or tissue paper. However, when it comes to newborn skin, there can be some detrimental effects. Some examples I highlight are, for instance, rough textured clothing. Wool, acrylic, or polyester can feel prickly even to adult skin, especially those with sensitive skin will feel particularly irritated by these materials. The discomfort and irritation will be even more pronounced when it comes to newborn skin. It's best to think of a newborn skin as lacking an outer layer of protection, which is afforded by fully developed skin. Hence, the clothes baby wears must literally feel as soft and comfortable as possible. Run the textile over the back of your hands for a quick test. We don't think twice about drying our skin with towels, but very often we are actually damaging our skin barrier when we rub our skin vigorously. Skin, when damp, is also much more prone to damage. Here's a tip: pat baby skin dry with a soft microfiber towel, which is a more absorbent material and is also softer to touch than traditional cotton fibers. By the way, don't use dry tissues on baby skin. These are considered irritating and can cause frictional damage. When it comes to clothing, I would say choose the material carefully. Opt for natural fibers, in this case such as cotton, in the highest thread counts possible to ensure softness and smoothness of the fabric. Textiles are quite literally baby's second skin. And if you live in warm climates, be aware of the concept of breathability, which means that the material and the design of the garment must allow airflow at the skin surface. When it comes to reusable cloth diapers versus disposables, I would recommend the former. Not just for the environment's sake, but for baby skin too. The same principle of skin breathability applies to the nappy or the diaper area. Disposable diapers made of synthetic materials can suffocate the skin by an occlusion effect, and this increases the chance of skin irritation. The microclimate around skin also affects the growth of microorganisms. By allowing air circulation around the skin, you encourage the colonization of skin by healthy bacteria, which protects skin from harmful infections such as yeast, for instance, in the case of candidiasis. Baby wipes are used to clean up soils and spills, but care must be taken as baby skin is fragile. Disposable wipes available commercially are typically made of a polyester blend, which can cause frictional damage. Also, the wipes are usually infused with a surfactant for a cleansing effect, which really isn't necessary on newborn skin. You would want to avoid disinfectants for sure, but chemical surfactants in general damage the skin barrier with repeated use. Disposable wipes are also not very absorbent. This effect is far more pronounced on a newborn skin as it is more fragile, so you definitely want to avoid that. Reusable wipes made of soft microfiber material are ideal as these are efficient materials which absorb soils and spillage readily. You also don't need to use any soaps. Water itself is a solvent, and when used with a microfiber wipe is sufficient for on-the-go cleansing. The technique of wiping also matters much more than you realize. In addition to using a soft fabric, try to pat rather than drag over skin, as this increases frictional damage. Now, my top tip for on-the-go cleansing would be to use a hydrating mist. An essence infused with botanicals like rice bran, soy, etc. have natural cleansing properties, which are gentle and soothing on newborn's delicate skin. Here is why you should consider building up baby's skin barrier from day one. The skin barrier does not just form a physical barrier to protect our body from external allergens. It must be thought of as a living organism, which, like every other organ in the body, communicates within itself and also signals to other organs. It traps moisture within, but it is still permeable, which means that it also continues to interact with the environment. And this is where the concept of the skin microclimate comes in. This little ecosystem plays host to microbes and germs which help to ensure skin stays free of the bad guys. In many skin conditions, disturbances of the skin microbiome directly affects flare-ups. In eczema, the skin of eczema patients is actually colonized with Staphylococcus aureus, which causes a secondary skin infection known as impetigo. I hope you've enjoyed this short tutorial, and I'd love to invite you to join me over at the Baby Beauty community. I created this brand new newsletter for you to access my expert pediatric dermatology tips plus on-demand video workshops all year round, and it's free. This newsletter is for mums and mums-to-be, those with a personal or family history of sensitive skin and eczema, as well as nannies or carers of young children. At Baby Beauty, we encourage skin resilience from day one. It is important to cultivate skin health. It's a lifelong commitment. With the right skincare routine, we can increase the skin's innate resilience to infections, barrier damage, and even improve the self-recovery process. Skin is equipped with sensors like nerve endings, and even the inflammatory response itself is designed to aid in recovery. When we fail to recognize the signs of inflammation and irritation, that is when the problem starts. The same with the immune function of skin. We are not meant to live in a sterile environment, but at the same time, the newborn's immune system is not fully developed, so a balance must be struck. These are just some of the insights I'll be sharing with you in this newsletter. I'll teach you about the science of how healthy skin cells communicate with one another, how skin cells, by sending signals, help to protect skin from stress and harmful germs. Skincare must be thought of as a way to recreate the ideal skin healing microenvironment in order to enhance beneficial processes. All this and more coming up.